Tell me, Zaina, what brings you in today to see me?
It's my father, doctor. I don't know what's happening with him. He's here with me today and waiting outside with a nurse. I'm worried about him, doctor.
Tell me, Zaina, what is worrying you?
He's forgetting many things lately. For example, he will ask when are we going to eat when we just left the table. He's forgetting my children's names, and he was brought back home by our neighbor because he was lost on the way back from the market.
I can see that you're worried about this. When did this begin?
I can't recall an exact time.
When do you think your father was last 100% his normal self?
Looking back, I would say a year and a half ago.
What did you first notice?
He used to be very involved in the family issues. He would take part in the family discussions and give his opinions. He slowly stopped participating in the discussions. He's getting old, as you know. So we didn't give him much attention at first, but things got worse.
I see. Does he have trouble expressing himself or speaking?
Sometimes he doesn't make sense, or he looks like he's searching for his words. For example, he looks like simple things like a spoon or a cup, and he can't think of the right word. So he becomes upset. At other times, he just comes up with new words that have no meaning.
So the trouble with memory and speaking started a year and a half ago and has gotten worse with time. When did he start getting lost?
Oh, that only happened a few weeks ago.
Overall, do you think things have been getting worse rapidly or are much worse recently?
No, not really. But when he started to get lost, that was when I knew we needed to have him checked out.
You were right to be concerned. Before your father began having trouble with his memory, did he have any other problems? Hit his head or had sudden weakness or numbness?
No.
Red flags. Young onset. Rapid progression of symptoms. Focal deficit on examination, such as one-sided weakness or slurred speech. Systemic signs, such as abnormal vital signs. Early incontinence or autonomic symptoms. Abnormal imaging findings.
Zaina, have you noticed any other changes in his behavior or personality?
It's like he's not the same person. He used to be very particular about his appearance and refused to go out unless well-dressed. Now he neglects his appearance, as if he doesn't care anymore about the way he looks.
Zaina, what kind of things was your father able to do on his own that he can't do now? Is he still able to take care of himself, take a shower, shave, and get dressed?
It's getting really hard for him to clean himself. When he goes to the shower, he gets out without washing the soap off. Recently, my husband is helping him with that. He used to shave and change his clothes daily. Now, we have to remind him.
That is really great that your husband is helping you and your father. Has your father ever had problems in the home recently?
Like what?
Like, for example, does he ever leave the faucet on?
No.
Does he drive? Is he eating well? Has he lost any weight?
Yes, he's eating well. I do not think he has lost any weight.
And how about at night? Are things different or worse? Or does he have good days and bad days?
No, not really. He's always the same.
Does he have any medical problems?
High blood pressure.
Is he taking any medication?
He takes some medication for blood pressure.
Does he smoke?
No.
Does he drink alcohol?
No.
Pertinent history. Sleep. Mood, such as anxiety or depression. Hallucinations. Social history. Habits, such as tobacco, alcohol, or diet. Level of education. Occupation. Family history.
Great. I would like to see him now and we will continue our discussion afterwards.
Sure, I'll go get him.
Hello, Mr. Ibrahim. I'm Dr. Saria. How are you doing today?
I'm fine.
I would like to ask you a few questions if you don't mind.
Okay.
Tell me, Mr. Ibrahim, what brings you to see me today?
I came with my daughter.
Okay, is there anything in particular bothering you?
Sometimes when I walk for long distances, my knees hurt, but it's not a big deal.
Are you having other difficulties?
Well, sometimes I forget things. That's what my daughter tells me.
Did you notice it yourself?
Sometimes I want to call one of my grandsons and I have a hard time remembering his name.
That must be frustrating for you. Let me see if I can find out what the problem might be. I'm going to examine you now, and some of the questions may seem very simple or silly to you, but please just do your best.
Okay.
Do you know the name of the current president?
Michael Sleeman.
Correct. I am going to tell you 3 words. I would like you to repeat them after me. Table, apple, key.
Table. Apple. You see, doctor, I'm getting old.
That is okay. Here, there again. Table, apple, and key.
Table, apple, and key.
Great. Now hold on to those items because I will ask you again in a few minutes, okay?
Table, apple, key.
Excellent. Now, where are we right now? What city and what is the address of this place?
In a doctor's office in Beirut.
Yes. What is the season?
It must be the end of spring or beginning of summer.
Yes, it is. And what is the date? What year and month is it?
It's 2013, the month of July. I know this is as my Father's Day just passed.
What day of the week is it?
Tuesday.
Okay. Now, remember those 3 words? What were they?
Apple. Table.
Yes, and the third? It was an object used to enter the house. A k.
I don't remember.
It was a key. That is all right. You're doing really well. Let's continue, okay?
Okay.
What do we call this?
Elbow.
And this?
Ring.
And this?
Pen.
And this?
Top of pen.
And this?
This is. You work at it. You sit down in the chair and then you put a paper and write. A desk.
You're having a hard time finding your words?
Yes, it's frustrating.
It's all right. We will try to figure out what's going on. I'll ask you a few more questions. Can you repeat something for me? Today is a sunny day.
Today is a sunny. Today is
Thank you. You're doing very well. I know this can be tiring.
Language examination. Naming. Ask the patient to name a few common objects, such as button, clock, or pen, and even parts of the object, such as hole, hand, or cap. Repetition. Ask the patient to repeat a short and long phrase. Reading. Ask the patient to read a phrase. Writing. Ask the patient to write a phrase. Today is a sunny day, or there are earthquakes in California. Comprehension. Command following. Expression. Is the patient's speech fluent?
Can you show me how to blow a candle? Okay, can you please point first to the window, then to the door?
That's the window and the door.
That's right.
Dementia is likely if, on testing, cognitive impairment or memory complaint has been present for at least 6 months, is progressive in nature, is associated with impairment of social function.
How's your mood lately?
I like to spend most of my time with my grandchildren.
Are you still able to enjoy things that you usually enjoy?
I like spending time with my grandchildren.
Okay, how's your energy? Have you been feeling tired lately?
Not at all.
Depression resembling dementia. In older people, depression can sometimes resemble dementia. Older people with depression can often be confused as having dementia because the symptoms of mild depression, such as irritability, low interest, and low function, are similar to dementia. In this case, depression should be managed first, and the person should be reassessed in 12 weeks for presence of dementia.
I would like to do a physical exam, Mr. Ibrahim.
Okay, doctor.
Physical exam. Look for obesity, dry skin, signs of malnutrition or dehydration, signs of cardiovascular disease, signs of head trauma, signs of stroke in walking, using the arms, or facial muscles asymmetry, goitre, signs of physical abuse.
Mr. Ibrahim, your blood pressure is good. I'll continue the exam. Can you please give me your hand? Also good. I'll check your eyes. Would you look at me, please? Follow my finger with your eyes without moving your head. Very good. Tell me which hand is moving while you're looking at me.
The right hand. The right hand too.
And okay, tell me in which ear you're hearing the sound.
Left. Now right.
Very good. Can you please open your mouth?
Physical exam. Examine blood pressure, pulse, slow hypothyroidism, or fast anemia. Neurological exam, vision, hearing, dentition.
Mr. Ibrahim, your physical exam is normal.
Thank God.
You're having some difficulties with your memory, finding your words, the recent problem of getting lost, and you seem to have some difficulties in your day-to-day life.
What do you think is happening with him, doctor?
I didn't find anything on the physical exam that makes me suspect a specific cause, such as thyroid or head trauma.
What is happening with me, doctor?
This is not normal aging, but before I make a diagnosis, I will have to request some simple blood tests to be sure there aren't any vitamin deficiencies, also vision and hearing tests, as well as evaluation of the heart with an ECG. With this, we can make sure there are no other medical issues that are causing your symptoms. When I have the results, we'll talk more.